Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Every person undergoes 2 stages of growing teeth, as a child with milk teeth and permanent teeth as an adult. This is usually between the age of 1 and 3 years for milk teeth or primary teeth and 9 to 25 years for the permanent teeth. Essential nutrients for a healthy tooth include calcium, phosphorus, and vitamins A, C, and D. However, nutrition has an effect on our teeth, and as a result, it is usually the cause of decay, staining, and cavities.
Number 1 factor is the sugary foods we eat. Number 2 factor is there are some microorganisms in the mouth. We call them the bacteria that reside in the bacterial plague. Number 3 factor is time. How much does that spend on your tooth in order to cause a tooth decay? Then the last factor is the tooth surface. That makes it ideal for this food substance to stay on the tooth so that you end up getting a decay.
The human tooth is made up of 3 main parts: the enamel, which is the hardest and visible in the mouth, the dentine, and pulp. And the effect of bacteria action on the tooth also happens in 3 stages.
On the outer layer, which is the enamel, you may not be able to feel any pain or any sensitivity or anything. It is quiet, but someone who is keen might see a color change.
Dr. Adakaru says once the cavities have gone past the enamel, one starts to feel extreme pain due to the infections on the sensitive parts of the tooth.
Then when it reaches the next layer, which is called the dentine, here the patient will begin to feel sensitivity. When they breathe in cold air, they'll feel uncomfortable. When they eat something that is sweet, they'll feel uncomfortable. When they take cold water, they'll feel uncomfortable. And as this decay, this cavity deepens, later the hot things also become a bother to the tooth. And at that stage, if it is not treated, this decay will continue up to the innermost layer of the tooth, which is called the pulp. So when it gets into the pulp, what happens? Pain aspect is going to come in.
He says the body will tend to neutralize the pain naturally, but infection continues inside the tooth, and this will cause adverse effects like swelling of the cheek.
Then later, after some years, this pain will become on and off. The patient can tolerate. And meanwhile, these processes are also continuing. From the pulp, now they're descending down to the tip of the root. So when they get to the tip of the root, the person is going to come back either with a pus, a swollen cheek, or is going to come back when the tooth feels like it is longer in the mouth. You'll have pain, which is very severe, which sometimes wakes you up at night, which sometimes causes you headache, which sometimes refers to other regions around that tooth.
Apart from decay, there are other infections of the gum. These, according to Dr. Adakaru, are not painful, and this is why people ignore them, yet they destroy the gum tissues and also cause a smelly mouth.
Sometimes it manifests with swelling of the gums. You'll have bleeding of the gums. The gums may be reddish. Sometimes they may be painful. Sometimes when the patient is brushing, they spit out saliva, which is with blood.
He says regular and proper brushing of teeth is sufficient to prevent decay and a smelly mouth.
The ideal brushing of teeth is supposed to be twice a day. We will say 3 times a day, but most times, because people are busy, lunchtime you're not at home and you don't move around with your toothbrush. So we say you brush in the morning, which will be after you've eaten your breakfast, but not before breakfast. But most people do before breakfast. So you should actually brush after breakfast. And then in the evening, the last thing you do after you've taken supper, before you go to bed, you should brush. And it is not just brushing, 1 second and that's it. Just as we said previously, tooth decay is sugar related. So when you regulate your sugars, when you try to minimize the quantities, you're actually going to, reduce a lot the tooth decay. And also we also say take time to do a checkup with the dentist.
As one brushes, care is crucial not to cause damage to the gum.
You should take time and brush on the teeth surfaces, brush on the surfaces, brush on the eating surfaces. And also sometimes we also encourage people to do flossing, because you realize that the spaces between the teeth are compact and your brush may not reach there very well.
Walter Mwesigye, NTV.
Thank you.
National Medical Stores, NMS, passionate about your life. With support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities